Good morning and good evening. Thank you for joining us for the final day of the U.S.-India Strategic Partnership Forum's fourth annual summit, Strengthening Resilience, Expanding Prosperity. Here to introduce our first session, a conversation with Ms. Rita Teaotia, please welcome the founder of the Jackfruit Company, Ms. Annie Ryu.
I am very pleased to introduce Rita Teaotia, one of the senior-most bureaucrats of the Indian Administrative Service, joining us along with Dr. Mukesh Aghi. Rita Teaotia is currently the chairperson of Food Safety and Standards Authority of India, also known as FSSAI. With a career spanning 35 years, she has worked extensively in both policymaking and practice in varied sectors, including energy, health, rural development, and communications. Prior to her current position, she served as a Commerce Secretary in the Ministry of Commerce and Industry from 2015 to 2018. She was Joint Secretary in the Ministry of Health and Family Welfare from 2003 to 2007, focused on food safety, drug control administration, and national disease control programs. In the Ministry of Telecommunications and Information Technology from 2012 to 2015, she oversaw standards, telecom manufacturing, and the telecom policy. Her key areas of interest are standards, logistics, and government e-procurement.
Well, good morning and good evening, Ms. Teaotia. Welcome to our annual summit.
Happy to be here.
And I have to say, you are among the very few senior women bureaucrats in the Indian administration, and you have executed in every position I've seen you very, very successfully, ably, the mission you were given. And I do recall working with you very closely when you were the Commerce Secretary, and we were able to take a lot of stuff forward, especially between India and the U.S. And great to see you great to see you now as a chairperson for the Food Safety and Standard Authority of India. It is such an important position, especially for a country which is trying to bring nutrition to the younger generation, trying to be equitable to make sure that the gap between the haves and haves not is not marginalized by food itself. So my question, as I look at some of the important things you're doing, let's start with the vision. How do you see the vision of FSSAI as you take this organization forward, transform it into a much more effective, efficient organization?
Well, the first decade of the Food Safety Authority, we focused on the standards and benchmarking with the global standards as well. So that was really our focus in the initial years. As we stand today, our focus is really on the enforcement issues, and the effort is to ensure uniform enforcement and implementation of the law throughout the country. And for this, we are engaging through a system of memorandum of understanding with the state governments with financial support. And the objective is really to see that the systems and the quality of enforcement is the same throughout the country. As part of this, we launched in 2020 the food compliance system. And that is an online platform. It allows the states to manage their data. It allows the food businesses to register, license. And as we nudge the food businesses towards self-compliance, it allows them to also upload their annual returns, their food safety audits, their laboratory results, all onto a single platform that brings all this together. Apart from improving the quality of compliance and the uniformity of it, we've really focused on the quality of our testing. We've got a network of 252 laboratories, and we launched a brand new laboratory, just 2 days ago at the Jawaharlal Nehru port, where the maximum food imports come in. And that's a state-of-the-art partnership with the Vimta laboratories. So these 252 laboratories are all getting accredited, all performing standardized testing. And the final bit, which comes from my last job, is really strengthening our food import system. 3 years ago, we covered about 25% of all the food imports directly, and the rest was through customs. Today, it is 75%. So in 3 short years, this is a journey we've made. And I think that we intend now to be able to manage all the food imports into the country directly.
No, that's great. And, I just saw the news this morning. India's food and agriculture exports are record-breaking, up by 22% compared to last year. So, it's interesting because the perception, the image is that India is a net food importer. But, the real story is India is a dominant exporter in the region itself. And my next question for you is how do you see collaboration between the private sector, especially U.S. companies, along with SSAI, as you move forward?
Look, there are several areas of collaboration. In most of our initiatives, we adopt a partnership approach. So whether it is the policy effort to reduce food losses and wastage, which means efficient production systems, it means improved cold chains, it means strengthened distribution channels, we work with industry. When it comes to reformulation of products to be healthier, we work with industry. When it comes to self-compliance, we again work with industry. So in terms of moving forward, in terms of adopting some of the new regulatory practices, the modern regulatory practices, we work with the industry. And I must say it's been a solid and robust partnership.
And when you look at these companies, we have, like Annie just talked about, introduced you. She is a CEO of a Jackfruit company, which buys jackfruits from India and then basically bring into what you call US as a nutrition, especially as a meat product, even though it's made out of jackfruit. And that's a tremendous two-way trade happening between India and the US just in that sector. When I look at from a priority perspective, what the message you want to give to the US companies as they look at procuring from India and exporting to the US itself?
I would say that they can actually feel confident that the regulatory oversight within India on product quality is fairly robust and improving. We know there's plenty of space to improve, and we are working on that. That's one piece of it. The second is that when you import or you rather buy the primary product from India, and when you formulate it, we are also a very large and demanding market. So there are tremendous opportunities here for quality products that are compliant with standards. And frankly, I believe that it can only be a win-win.
That's true. That's true. And we're seeing more and more companies such as ITC exporting packaged food to the US, which are in almost every grocery store now, and they become very popular. I know you dealt a lot, especially on issues of shrimp exports to US, and you dealt with mangoes issues, and there was certain biasness towards those goods coming from India. And as a chairperson of FSSAI, what is your message to the regulators in the US on these standards and the quality which is coming out of India to the US itself?
I would say that all trade relations must be built on mutual respect. When we export to the United States, while we ensure that compliance to our own standards, we also ensure that we meet the regulatory requirements of the US market. I think it's when in reverse, when we import food from the US, and we import quite a bit, almonds, some fruits, etc. They need to meet our labeling and our quality requirements too. So I think the requirement really is to have much more robust interaction between the regulatory teams and also much more capacity building of each other's food businesses so that they are able to comply with the regulatory requirements of either market. And I think that over the years, we have improved both in substance and quality the level of interaction with the US regulatory authorities.
No, that's good to hear, because you have here just a US Center for Food Safety and Nutrition under the Food and Drug Administration. Does your team work with them, collaborate with them, making sure that they're in sync from standards, from quality and export perspective?
We have with the US FDA an engagement that focuses around standard setting, the technical collaboration, some level of trade facilitation, and capacity building, all these areas. And I think that reflects in the improved smoothness of the agricultural trade between the two countries. But the Center for Food Safety and Applied Nutrition of the US FDA, I believe, can be an excellent partner for our international Center for Food Safety and Applied Nutrition, which itself actually is born out of an MOU between the Food Authority, the Export Inspection Council of India, and the Global Food Safety Partnership of the World Bank. So they have only one center in Maryland, and the second one is in Mumbai. So I believe it's a great collaboration and a great potential.
So when do we see you coming to Maryland and visiting the center?
When COVID-19 is behind us.
Okay,
I think
I'll keep that in mind, because we'd love to have you come here and connect with the U.S. companies which are importing from India at the same time exporting into India. But let me just come back to on the standard side. Obviously, as India economic standards rise, as India exports, and you have 4.5 million Indian Americans who still love their packaged curries and mangoes coming from India. How are you working on streamlining those standards so there's less hindrance for both sides, either export and import, and all the impediments are removed as they start moving these supplies either from India into the US or from the US into India?
Well, let's look at which is the common standards which unite us. And the Codex Alimentarius Commission is where both the United States and India, almost from the outset, we've been part of the global standard setting process. We align nearly all our standards with the Codex standard. Of course, we factor in the domestic risk-based assessment, the Indian physiology, but we are largely aligned. And we do this because it's critical for our trade, and it's critical also for the quality of product that we give to our own consumers. So I believe that our effort to meet these standards is something that we've been working on from the outset. All our horizontal standards are actually in alignment with the Codex. Most of the vertical standards are already in alignment, and this is, of course, an ongoing process. So that level of confidence, I believe that we can have. If there are particular labeling requirements for the United States market, of course, we meet those too.
No, that's great.
And we do,
one of the topic and issue which is dear to the Prime Minister is environment and sustainability. And when you look at food packaging, it becomes, I call it environmentally, it pollutes, because when you look around, people just use the package and throw it away. And how is your organization working on packaging and sustainability and protecting the environment also?
So we do have a food packaging and regulation that we issued a couple of years ago. While that looks at quality and safety primarily, we also focused on reduce, reuse, and recycle. A couple of years ago, 2 years ago, we permitted hotels to actually offer water in glass bottles, reusable glass bottles with paper seals to their guests in order to reduce their plastic footprint. We have taken pledges from the food industry to redesign their packaging to be more environmentally sustainable, pledges to completely eliminate virgin plastics, and most important, we worked with the Ministry of Environment, which has recently issued rules that permit reused plastic for carry bags and for food packaging, so that this provides a scope for recycling of the plastics by the food industry in a safe manner, compliant with the standards. And finally, oil, as you know, is used extensively in Indian food. And this oil gets reused and it generates what we call total polar compounds. We have brought in a regulation that controls this, but more important, that a system that collects the used cooking oil and converts it to either biodiesel or diverts it into soap and other products so that it doesn't get back into the food chain. So this is a very major effort. We call it the reused cooking oil program.
Well, that's fantastic, because I think that's a big challenge when we look at India from every aspect. And, I just want to give you all the assurance that anything we can do from US and US companies on this effort, you please count on us as our support there, and we can convey the message to our member companies to work with you from that perspective. My next question to you is, in the US, 30% of the food wastage happens in the plate, and whereas in India, 30% of the food wastage happens in the farm field itself. And that's to do more with storage, supply chain, packaging. And what can the US companies do to help reduce that wastage on the farm and making sure that at least there is more efficiency in the supply chain?
I have to tell you that in the pledges to reduce the plastic waste and recycle plastics, in the pledges to reduce the trans fats, industrial trans fats in our food, and in the commitment to improved food production, cold chains, and distribution systems. The multinationals, including those from the US, have been right there at the forefront along with the Indian companies. So we welcome this because they bring with them technology and practices that they have already adopted, not just in their own countries, but across the globe. And it enriches our ecosystem as well. and supports our local food businesses to adopt similar practices. So it's really been it's a sort of seamless effort. I think most of the multinationals are deeply engaged with our work and with many of our Eat Right initiatives, and we welcome that.
No, thank you. And, my final question, I know we have almost a minute left, and to you is, when you look at the vision of the organization as the leader, the chairperson of the organization, what would be your definition of success when you look 3 to 5 years forward from now?
The biggest challenge for us really is ensuring the uniformity of the product quality and its safety throughout the country. And all our efforts are geared towards that. So I think that if we emerge as a modern organization, working with new age platforms, improving the compliance, the quality of our surveillance, the quality of our testing, I would say that that really is our goal. So that our consumers are safe throughout the country.
Okay, no, that's great, and I just want to say thank you for taking the time. I know you're a visionary leader. You've been very effective in different positions, and I think you'll do a fantastic job as you transform this organization. We also, from a USISPF perspective, want to convey that we are here. Reach out, and we look forward to hosting you in Maryland when you come as COVID situation settles down. Once again, thank you for taking the time. We wish you well, and please be safe. Thank you.
Thank you very much.
Ladies and gentlemen, thank you for joining us for the USISPF 4th Annual Summit. I'd like now to invite Ms. Annapurna Das, Country Head of India and Cluster Head for South Asia at Sanofi Pasteur. Ms. Das comes with over 2 decades of experience in the healthcare industry across therapeutic areas, including vaccines, in India and South Asia. Please join me in welcoming Ms. Das to introduce the discussion.
Thank you so much. Good evening, everyone, and a very warm welcome to this unique forum, and really to be honored to be having such delegates this evening. The topic that we will discuss today is role of vaccines in building a resilient healthcare ecosystem. Everything rings a bell. Vaccines, resilient healthcare ecosystem, especially in the last 18 to 19 months that we have lived through this pandemic. I have the absolute honor and pleasure of welcoming for this discussion Professor V.K. Paul, Member NITI Aayog, Government of India. Sir, it's an honor to have you, and for me, it's really a privilege to have this time and listen to you. I'm looking forward to it. Dr. Randeep Guleria, Director AIMS, and who better than him to talk about this particular topic, who has been guiding the nation, both Professor Paul and Dr. Guleria, guiding the nation in shaping decisions that safeguard the country through these difficult times, and always, of course, during this course of how we have evolved in providing universal healthcare to this country. And I have the honor of pleasure also inviting my friend and my ex-colleague, Ms. Julia Spencer, Head of Global Vaccines Policy, Merck. Julia, absolutely pleasure to have you this evening. Before I hand over to Julia, who will be really moderating this session and have absolute great conversations this evening for such an important topic, Maybe I'll use the opportunity to share some thoughts and, as they say, set the scene for a great conversation. What we saw in the last couple of months is that the COVID-19 really disrupted the healthcare delivery. And before, I think I was reading a survey that around, which was a WHO survey, if I'm not wrong, 155 odd countries, we saw even for chronic diseases like hypertension, diabetes, other complications, there is almost 40 to 50% disruption in that. So definitely resilience is the word. And if what I will be really looking forward to hear from this, that what's the definition of a resilient healthcare system? If I reflect back, I look at it as a system which is aware. Does it have a very updated information system of all human and physical footprints across the country or across the geography that we're talking about? I think something like what we have, Ayushman Bharat, the digital mission, will definitely be a great step towards creating those unique IDs for every citizen. What also defines resilient is diverse. Are we really in a position to address broad range of diseases, manage broad range of health challenges, and not very few targeted ones? I think over the last several decades of our since independence, we have kept on adding our ability to treat and offer under public health or private health diversity of healthcare challenges. And I think H1N1 challenge, the way we have managed that with the outbreaks off and on, is a very unique example that we have been able to do that. The third adjective which comes to my mind is something probably which is more adaptive and evolutive. Does it, I think, exactly what we saw now with something like an COVID app or changing into very fast, accelerated critical healthcare settings? That's what an adaptive and evolutive healthcare. Can we really keep this evolution that we have made with COVID to really help for adapting vaccination and lead this nation to build much more resilient than where we are today? The last but not least is something which is self-regulation. And what example comes to my mind is the Nipah virus case, correct? I think the whole approach of healthcare system, isolating itself, identifying early signals, kind of taking all those necessary steps is something which talks about resilient healthcare. I'll just quickly maybe spend one more minute talk about vaccination, the role of vaccines. I think we have seen that historically we have been a nation very focused on pediatric and to a certain extent pregnancy-related vaccination. What COVID taught us that's always needs to be much more to cover adults as vaccination. Vaccines preventable diseases, if I take as at a broader level, probably out of a population of 1.4 billion, we will have 10% people protected from vaccines preventable disease. So there is definitely a large opportunity that is for vaccines coverage rate. Vaccination strategy, and what I will really look forward to hear from the experts that we have and very honorable delegates we have, that can we look at vaccination strategy not just for protecting individual infections, but really looking at overall health, especially focused around comorbidities like diabetes, hypertension, CHD, CKD, all kind of comorbidities which create so much pressure. I'm keen to hear that how do we look at merging treatment of these diseases with vaccination strategy? Can we look at treatment of these diseases, integrating vaccination where treating physicians are not treating just the disease, but are also offering vaccination as a part of protocol? Can every anti-diabetic patient be also given the right vaccination so that the pressure on the healthcare system and the resilience of the healthcare system really amplifies and we lead to have a much more better health outcomes by putting those who need the vaccine and driving vaccines coverage rate? I'm looking forward to this conversation. The pandemic is putting to the test not only our healthcare preparedness, infection control mechanisms, but also how robust is our supply chain, our markets. And today's sessions, we have the best minds coming together to share their perspective. So I'm all here enthusiastic and looking forward to hear them. On this note, I hand over to Ms. Julia Spencer to introduce the panelists and to take the session ahead. Julia, over to you.
Thank you so much, Annapurna, and it's wonderful to see you again.
Same
Maybe
here.
I'll continue to set the scene just momentarily, and then get on with introducing the esteemed panel that we have. So going into 2020, talking about vaccines, the vast majority of countries around the world had basic functional immunization programs to protect babies and children against vaccine-preventable diseases. Over the last couple of decades, we have seen a trend in more countries providing vaccines in adolescents, but most governments came into this pandemic without the infrastructure, financing, or expertise to support a life course approach to immunization. This is one of the chief reasons why the new Immunization Agenda 2030 has as its vision a world where everyone at every age fully benefits from vaccines for both health and broader well-being. And that strategy was finished before we knew what COVID-19 was. But then 2020 happened, and in every country and in every corner of the world, people began to understand the importance of life course immunization, whether they realized that was what it was called or not. Older men and women realized that they were at higher risk for more severe outcomes because their immune systems didn't protect them as well as they did when they were much younger. And restaurant employees, school teachers, healthcare workers realized that their jobs and the associated interactions that they had with people put them at greater risk for contracting infectious diseases. And adults were getting sick and dying when children were not. And this pandemic and the COVID-19 virus have made us fundamentally rethink many things. And in the immunization space, two of these things are that we need to be able to vaccinate adults with the same efficiency and effectiveness as children, and that we must consider people's lifestyle risks like jobs, travel, comorbidities, and health risks because of where they live, not just their age, when recommending vaccines for them. And there's a third lesson that I think you'll agree we're learning through this pandemic, and that is that all decisions are hard decisions with no easy answers, and we must be realistic and practical. So today, no matter who you are or where you live, you can see that vaccines play an essential role in the functioning of society. They keep schools open, they keep tourism going, healthcare systems operational to be able to address the diverse medical needs of their populations, and it makes the workforce able to work and contribute to economic growth of nations. Because when you don't have vaccines to prevent life-threatening infectious diseases, as we have all seen, society can quite literally shut down. Vaccines help to keep people well and out of the healthcare system, and that is so apparent right now. In many ways before this pandemic, vaccines were so effective as a strategy to keep people well and society going that many people and many policymakers really took them for granted. And so with this backdrop, it's my pleasure to be with you today and with our esteemed guests to talk about the role of vaccines in building a resilient healthcare ecosystem. And what a discussion it is going to be, because we have two of the experts with us. So before I introduce them, just a little bit about myself so you'll know who's guiding this conversation. As Annapurna said, I lead our Global Vaccine Public Policy and Partnerships Group at Merck, or MSD as we're known outside of the United States. And I've been with the company for about 7 years. Prior to that, I spent my career working in Washington, D.C. with the U.S. Department of Health and Human Services, doing science and public health policy. So I feel like I really have a good understanding of what it feels like to be in the chair of a government official right now as we're all trying to address this incredible crisis. So Annapurna and I have set the stage, explaining the state of play with vaccines and the potential that they have to improve the health and the economic conditions around the world. And now we're going to spend the next 40 minutes or so digging in on the situation in India. The country has been one of the most visibly impacted by COVID and is one whose population and geographic size mean that mounting a rapid and effective response to just about any population-wide problem is challenging. Challenging, but not impossible. And as we've seen by the heroic efforts across India over the last few months. And so I want to just start by applauding all of those who have been working to respond to the pandemic and its health, social, and economic impacts in India. As a former government health official myself, I recognize just how daunting a health and humanitarian crisis of such magnitude is to respond to. And I appreciate it's not easy to think about how to do things better when you're still in the middle of a crisis, but we're asking our panelists to do just that today. So thank you to both of you for doing that and for being with us. So let me start by introducing Professor Paul, who is a pediatrician by training, has been on the faculty of the Department of Pediatrics, the All India Institute of Medical Sciences in New Delhi since 1985, and served as the head of the department for nearly a decade. He is globally recognized as a medical scientist and public health expert. The government of India appointed Dr. Paul as a member of the National Institute for Transforming India in August of 2017, where he leads the health, nutrition, and HRD verticals. Dr. Paul also served as the chairman of the Board of Governors in super session of the Medical Council of India for 2 years from 2018 to 2020. And his tenure was recognized for a record increase in undergraduate and postgraduate medical seats, an introduction of telemedicine guidelines, district residency scheme, and a plethora of other reforms. Importantly for us here in this discussion today, Dr. Paul is part of the core team of the Union Government for COVID-19 pandemic response. He chairs the Empowered Group on Medical Infrastructure and COVID Management Plan, as well as the National Expert Group on Vaccine Administration for COVID-19. Welcome, Dr. Paul, and thank you for being with us. And Dr. Randeep Guleria is Professor Head of the Department of Pulmonary Medicine and Sleep Disorders at the All India Institute of Medical Sciences in New Delhi, where he has been for the last 23 years. Dr. Guleria is the first Indian to get a Doctor of Medicine in Pulmonary and Critical Care Medicine. He joined the Institute in 1992 as assistant professor in the Department of Medicine, and in the subsequent years, he has been promoted to the posts of associate professor, additional professor, and professor. He has done pioneering work in respiratory medicine, and the Department of Pulmonary Medicine and Sleep Disorders has been created under his dynamic leadership since 2011 and has been ranked as the best department in pulmonary medicine in 2014, 2015, and 2016. Dr. Guleria was conferred with the prestigious Padma Shri Award in 2015 by the President of India, and recently the Dr. B.C. Roy Award in the category Eminent Medical Person for the year 2014. So welcome, Dr. Guleria, as well. And I mean, can we ask for better experts on this panel today? So Dr. Paul, let me start with you. Full disclosure, I'm a doctor of public health and trained as an evaluator. So I always like to start with problem identification and measurement, and that takes data. In India, the burden of vaccine preventable diseases is not quite so clear, as there can be a paucity of data regarding incidence and morbidity and mortality among adults. Although what we do know through some studies is that there is a heavy burden of vaccine preventable diseases in India. As a public health expert and really a visionary in this country in public health, what is your suggestion on having a mechanism to collect data on vaccine preventable diseases for adults and elderly, and how do we enhance the epidemiological research in this area?
Thank you very much, Julia. And I'm pleased to be in the company of distinguished Dr. Guleria, Ms. Aparna Das, and colleagues, and to be on this forum, which is a bridge between US and India. Grateful. Actually, you asked a very simple question. Is there a need for more data on VPDs? Of course. Indeed, we need more data because if we are expanding the coverage of vaccines in adult population as and when such vaccines are available, are affordable, are scalable, we do need data. But on the other hand, we have tremendous amount of data for childhood vaccine preventable diseases. We have a world's one of the most robust childhood vaccination program in the country, which is an amazing system running very, very efficiently, and a huge coverage well above 75% and more than 90% for some vaccines. So we have a database for those illnesses. But your point that if we move forward toward vaccinating healthy adults, then healthy adults to be protected against diseases that come to them through vaccination, as and when available, and we have some, truly we need to estimate those diseases and their severity and their distribution, epidemiological distribution, etc. Surely. I think to begin with, the notion of vaccinating adults is a valid public health thinking. We did not have many vaccines which work which prevent illnesses that accrue in adults, but we have some. We have for flu, for example. We created one for H1N1. It was not needed later on. So we have some choices, and indeed a nation which A, has the capacity to create vaccine, scale them up, export them, and B, because we would like to protect our population to the best possible extent with preventable diseases, this should be a public health debate, public policy debate, and going forward, this option should be very much entertained. And of course, in the context of COVID, somewhat different. This logic and this opportunity and this need has been taken to logical conclusion. So I would essentially say, going forward, if there are diseases that we can prevent through vaccines in adult population, even particularly more high-risk population by age or by any of the criteria, yes, indeed, we should examine that issue through the lens of science and affordability and scalability, as well as we should be prepared for the right kind of epidemiological and other data that we need.
Thank you so much, Dr. Paul. And you've said some really important things about how you might think about this. And I'm going to ask you to touch on those as we get a little further in the discussion. But right now, I'm going to turn to Dr. Guleria and ask you a slightly different question. You're a clinician and a professor who's been engaged in training other clinicians for many years. What is your impression of the healthcare practitioner community and even medical students' understanding of the burden of vaccine preventable diseases across diverse populations in India?
Thank you, Julia. Thank you very much for inviting me. And I think this is a very, very important question because I've been sort of grappling with this for more than 25 years. And I'll start with explaining why. For many physicians, especially internists, many adult vaccine preventable diseases don't need a vaccine sometimes. That's what they think. They would argue that natural immunity has occurred. 25 years ago, when we started talking of influenza vaccination in adults, many people said that influenza doesn't happen in tropical countries and you don't need a vaccine for India. It took a lot of data, the ICMR flu network data, to show that not only do we have influenza, we have two peaks of influenza, both during the monsoon months and during the winter months. And we spent a lot of time. It was the H5N1 bird flu outbreaks which happened in parts of India in poultry and the H1N1 pandemic, which made really people sit up and realize that, yes, we do have influenza in our country. So I think there is a need to really change the mindset among clinicians. The challenge that we have, unlike the pediatric population, is that we have specialists in all areas. I'm a pulmonologist. I can convince people in my fraternity about vaccination, and I'm sure that they would be more acceptable. But you need the cardiologist also to give vaccination to their elderly with heart failure. You need the nephrologist to give vaccination to their patients with chronic kidney disease. And therefore, you have to get multidisciplinary people on board and make them understand the importance of adult vaccination. That is the challenge that we have in our country. And we are looking at not only COVID has taught us that we need vaccination, but we were talking of the influenza vaccine. We have a quadrivalent vaccine now. We were talking of pneumococcal vaccine for adults, and we, for our patients, aggressively vaccinate them or at least promote vaccination when they are admitted. because that's the time when they are more willing to get vaccinated. But the challenge that we have is, in a country like India, is basically looking at how do we develop a vaccine which is affordable, how do we deploy it, and how do we do a equitable allocation. Because remember, unlike the pediatric population, the adult population is much larger. And therefore, we have to look at multiple factors, getting acceptability among clinicians, getting patients to come forward and take the vaccine. And the flu shot is an annual shot. So then we have to work on getting it sort of on an annual basis rather than once in 5 years or things like that. So multiple challenges that are there for adult vaccination. But I think the pandemic has really woken everyone up that we need to develop a strategy for adult vaccination, and we need to see how we can do it. I've been asking a lot of our internist, family physician friends that you could become vaccinologist, and it's a good area to develop, where you could, in your outpatient clinic, start giving vaccines for influenza, pneumococcal, and other adult vaccination, and that could also be a good way of taking it forward. But I think there has to be more awareness among clinicians that unfortunately is lacking, and we really need to work aggressively into getting awareness about vaccine preventable diseases and how it can reduce the burden of disease in terms of exacerbations. Patients come to me and tell me, I took the flu shot and this time my winter months were very good. I didn't have worsening. And they come every year and ask me, has the new vaccine come and can I take the new vaccine for this winter? So I think if we are able to increase awareness, it will really help. And COVID should be one area that we can push for this, not only from COVID point of view, but for vaccination in adults.
Those are such incredibly important points, and thank you for your advocacy with your colleagues and with your patients on the importance of vaccination. Dr. Paul, I'll turn to you and ask you, do you have anything to add from your perspective on how to increase that awareness and understanding within the healthcare practitioner population?
Before we do that on scale, we must keep in mind the fact that when a vaccine has to be offered to adult population, we have to be in a position to expand it to everybody who needs it from the government's point of view. It is clearly a clinical imperative, as Dr. Guleria clearly stated. It should become part of the practice, but that's practice, an individual patient interaction based practice as of now, and it can be done even now, as Dr. Guleria has been promoting, and we are very proud of that. And I take his prescription for my dad, for example. That's one level, and that should move, and this nation can provide increasing amount of such vaccines should the need arise and should the scale up and the business models start to work. But when we are looking at vaccine or vaccines to be delivered as a part of national program, as a part of national policy, then other things kick in. Firstly, we need a large stockpile to be available on an ongoing basis. We need affordability. We need our ability to take it to scale, because nobody can be left behind. No one can be left behind. It cannot be, in that context, be left only for those who are in urban areas and are having, Dr. Guleria talked about equitable distribution. I'm echoing that and going further to say that making sure that they are connected to the vaccine delivery system, as we have done in the case of COVID-19 vaccine program. Of course, it will be a sustained campaign. Of course, it is a large population, and therefore, new ways and means of implementing such a large mission would be required. I think the bottom line is two levels. One, identify diseases that are of profound public health importance, and I think influenza perhaps would fit in if we have the right numbers and so on. Why not? Identify affordable, deliverable vaccines in a sustained manner, and then go on to start making it as a part of the national endeavor, and I think it's possible. So moving from a practice which is, or an intervention being delivered interactively by a physician to a set of patients or individuals, this has to be then expanded to a level where there is a universal access. And that would be the step in the right direction in a manner to build the imperatives to be able to achieve that. This is the change that would be required if truly this approach has to be mainstreamed as a part and parcel of the healthcare system and healthcare paradigm of India.
So thanks so much. And that was a wonderful segue to the follow-up question that I had for you, Dr. Paul. So as you said, the pediatric immunization program in India is very well established, and it requires a kind of infrastructure that may look very different than what you need for non-pediatric immunization. And as you also said, that India has a very large population. It has a very diverse set of potentially vulnerable adults who are served by various categorical health programs like those for diabetes or HIV. What do you think is a realistic approach, kind of getting into the nuts and bolts of this, of establishing this kind of adult immunization strategy in India? How do you do that from a systems perspective? And to your really important points, and Dr. Guleria's, how do you prioritize that from an epidemiological perspective?
So the first part is truly to be able to identify the conditions where sustained, large-scale, affordable availability of the vaccines would be possible, or it could be envisaged. That's a critical point. And there, to begin with, can be an approach to identify and prioritize people with more serious illnesses. Although, when you take it to scale, such identification, non-universal targeted identification and detection is not easy because it gets complicated. We can come back to that later. But I think the critical need for a nation of our size would really be our ability to have affordable vaccines. Vaccines that can be scaled up, can be rolled out through the program that we have. So something like a situation that prevails in childhood vaccines today, we don't have to be worried about the supply chains and the production, and we serve the world, in that space. So I think there are two elements. One is zeroing on to the population at the national level that requires vaccine. Which one gives us best dividends in terms of outcomes, health outcomes, out-of-pocket expenditure, enhancement of life, reduction in the risk of secondary and tertiary complications of an underlying disease. That's one paradigm. But the second one, which is equally important, is the ease and the access. Ease of delivery and the access to affordable vaccines. Of course, we must also remember, and that can be the third point, that if we have to move in that journey, then we as a nation must also move rapidly into manufacturing the vaccines that are potentially available in some part of the world today, and also be ready to invent vaccines that could be required on the horizon using the technological platforms that are available. So India would also like to ensure that these vaccines are made in India, these vaccines are developed in India, and I think that's the way our vaccination program will move on these three pillars. Thank you.
Thanks so much, Dr. Paul. Really important points, and I think a great set of starters for a question I'm going to ask you in just a minute. But let me turn to Dr. Guleria on this same idea. What role do you think the healthcare practitioner community can play in helping to advance this idea of more of a life course immunization against vaccine preventable diseases in India? You have a unique position as both a leading healthcare administrator as well as one of India's most preeminent experts in respiratory medicine. what advice would you give to the government and to the people of India in general on how to immunize against various vaccine preventable diseases that are of concern?
So I think, as Professor Paul mentioned, it is multidimensional. From the first point of view, it is, of course, the vaccine being available. So deployment, production, affordability, maintaining the cold chain, and then prioritizing it based on the burden of disease and who would benefit the maximum has to be done. But I think two other important issues are also there. One, of course, is getting the users, that is the healthcare workers who are going to vaccinate, come forward, accept the utility of vaccination, and build it into their day-to-day practice. That also has to be built in, because unlike how it's going on in the pediatric age group, where it's now become well accepted, we still need to develop a program for adults where the acceptability across all specialties has to occur. So it has to be done in a more robust manner so that we have all stakeholders on board. And we also have to look at the market forces so that the vaccine availability is there, not only from the production point of view, but also from the point of view of that it is locally made. The reason why I'm trying to say that all of this has to come together is that many years ago, I had talked to some industry people and said, why don't you make an influenza vaccine in India? And the answer that they gave to me was that the market isn't there in India. We won't be able to sell enough doses in India if we were able to produce a large amount, because the acceptability of adult vaccination among the doctors and physicians was not that much. So we need to get that acceptability there, work along with them, and also get the market forces aligned along with the production and the cold chain maintenance. Unless we do that, the program will have challenges. But I think the most important factor is prioritizing and affordability, because that will be very useful if you want to have a vaccine program for adults which is sustainable and is able to really have the life cycle course of immunization.
Yeah, thanks, Dr. Guleria, for those really important points. And I think, between you and Dr. Paul, you've really described kind of the chicken and egg problem. We talked about having data so people understand that there is a problem, and then how do you get people to acknowledge that there's a challenge, to want to do something about that challenge in order for a solution to come forward. And I think that's why these kinds of conversations are so critical. So I'm going to go back to my history working in a government planning office and really try to dig in a little bit on how you would actually make this happen here in India. Dr. Paul, who do you think needs to come together to make a start at this kind of conversation? For example, do you see the National Institute for Transforming India playing a role in consulting on this? And who would the experts be that you think would come together to deliberate on revising the immunization strategy to be able to address some of the things that you've raised today? What do you think Aghi or other groups could do to play a role in this?
I think you have correctly identified the issue as a chicken and egg problem, but it can be solved. It is not an insolvable chicken and egg problem. I go back to the vaccination scale-up story of H. influenzae B or rotavirus. Same story. The need was there, potential need was there. It was not part of the national program. It wasn't even getting imported for others. Rotavirus vaccine, the same story. Then it was becoming quite evident that the vaccines are effective and we have a disease. And gradually, an atmosphere was created that such a vaccine would be needed. That's an advocacy effort backed by science and evidence and the potential of saving lives and potential of saving Delhi's. And in step with opportunities to create and to adapt the vaccines that were available. For H. influenzae, if I'm right, it's largely the existing vaccine that was started to be manufactured here. For rotavirus, we actually invented the vaccine. And it happened. And over a period of, I think within about 4 to 5 years of the vaccine being made available, it's now part of the universal vaccine program. So every child, every infant, every newborn, 6, 10, 14 weeks is now entitled to receive rotavirus vaccine. It's a now nationwide program after a phase of 5 states and a few more states. But the vaccine came into picture only in 2014, final product. So it can happen in tandem. There are ways of doing it. And our science enterprise, coupled with academia, champions, and coupled with industry, it can happen in step with each other. So I think today we don't have to go, to wait for, one thing to end and the next one to happen, sort of a situation. That was a slightly different paradigm for some of the previous vaccines. But in more recent times, both things can happen in step with each other, provided, as you correctly started with, have data, we offer, scientific evidence as to what we will achieve by way of better health and saving and better life. And in the meanwhile, work toward making such capacities available within the country. The way our nation would operate would be that we would like to see these capacities for vaccine in India. And you have seen that even in the context of COVID-19, where the time windows were relatively short, the nation rose to the occasion. And we have a plethora of vaccines available on the stockpile, the pipeline of production and R&D, which we are very proud of. So we have multiple platforms, DNA platform, mRNA platform, you have protein subunit, you have an inactivated virus, and then other virus, other vaccines, including the nasal vaccine on the horizon. So multiple platforms are available. They came up rather quickly, and each one of them is promising in terms of the volume that we can create. So the short answer is yes, it is chicken and egg, but I think you can tackle them in a sensible way together, provided there is a decision, there is a movement, there are champions, there is science, there is rationale, and there is a clear vision that we have to achieve, but at an affordable cost.
Thank you so much, Dr. Paul. I think you've laid out really well what that parallel set of activities are that needs to come together into roadmap for getting this done, and recognizing that it's going to be an incremental process, but you need to get all of the right stakeholders around the table and moving in that direction. So, I think you've really touched on what needs to happen from a policy and a systems perspective. And I'm going to go back to Dr. Guleria for your perspective on the criticality of making sure that those policies and systems actually come to life through the healthcare system. And that, and as you've said before, if people don't see the value in them and they don't realize and recognize what their promise is, then that promise is not realized. And so in that vein, I'd like to get your perspectives on two things with regard to healthcare professionals. One, which you've already touched on, is the healthcare professional as a patient. And I know you know the data better than I about the vulnerability of healthcare workers to infectious diseases like influenza due to their jobs, and the very significant incidence of influenza and related diseases in the healthcare practitioner community in India. And at the same time, there is that very, very low vaccination coverage rate. So what is your recommendation on getting healthcare workers to understand the benefits of vaccination? And then kind of going to the healthcare professional as an educator and a vaccinator. And I think you've made some great comments about this already. How do you get the attention of those healthcare workers, once the systems and policies are in place, to ensure better adherence to clinical guidelines and to get them to talk to their patients about and to recommend vaccines? And I think they're probably linked to each other a bit, but would love to hear your perspective on both of those challenges with the healthcare practitioner community.
Thank you. I personally feel that as far as healthcare workers are concerned, it is something that we need to work in increasing awareness among them, but also to some extent nudging them and pushing them to get themselves vaccinated, because it's not only for them, but it's also for the patients that vaccination is important. We would not want a person to have influenza and spread it in our ICU or in a transplant unit. And that's why it's very important to have healthcare workers understand the importance of getting themselves vaccinated. I've had this challenge. I've been working aggressively to get my residents to get themselves vaccinated. Many of them were reluctant, saying that, I think I've already got flu in the past and therefore I may not need the vaccine. I have natural immunity. I used to send all of them to the our employees health scheme OPD to get themselves vaccinated. Many of them were not going, and I then flipped it, and we got the vaccine in our ward into the OPD and gave it right there and made sure all our residents got the vaccine. And you have to lead by example, so you go and get yourself vaccinated, and then get all your residents and other faculty also come forward to get themselves vaccinated. So it has to be a sort of a movement among the healthcare workers, and they have to realize the importance of getting themselves vaccinated, not only to protect themselves, their family members, but also their patients. Secondly, when the second part is actually, there can be two parts in that. One is, of course, increasing awareness among physicians and making them understand how you can decrease the burden of disease, or how you can decrease mortality by vaccinating people who are at high risk of getting severe infection. There is data which is available, but it has to be collated and shown to them, especially which is more, let's say, from our own country rather than from the Western world. And at the same time, it's also another thing that I've realized is sometimes it's important to educate patients also. If the patients ask the doctor that, should I take this vaccine? I've heard it's useful. Then sometimes that also is helps or changes the doctor's mind, and he says, yes, you can go ahead and take the vaccine. So along with the program that we start, we will have to start an awareness campaign both for healthcare workers, for doctors, and probably for patients by using various groups. If we are able to do that, then I think the two things would work together, and we will be able to have a large number of people willing to come forward to get themselves vaccinated, doctors prescribing the vaccine, and the supply chain being available for an affordable vaccine which is made in India and therefore is easier to give to the large population that we would need to give it to.
Thanks so much, Dr. Guleria. And I love this idea of leading by example and creating a model. And I have to say that, both you and Dr. Paul are just incredible champions and models for that kind of change in India and around the world. So really appreciate all of your efforts. And maybe just with the minute and a half we have left, I will ask you both to spend maybe 30 seconds on what is the one thing that you would like for us to take away from this conversation about the role of vaccination in improving health systems and bettering well-being and health in India. Dr. Paul, maybe I'll go to you first.
I would like to understand better which adult vaccines and vaccination programs can give us great dividends going forward, and at what cost.
Excellent. And Dr. Guleria.
So I would echo that. I would say that we need to have a database from our own country, also looking at the cost effectiveness of the vaccine to show that it really helps in saving lives and is making a difference. If we can do that, I think we would be able to convince more and more people to come forward, both in terms of policymakers and in terms of healthcare workers, to get themselves vaccinated.
Thank you so much. So well said. Thank you for your thoughtfulness and taking the time to provide your expertise with us. And I also just wanted to thank, in wrapping up, the US-India Strategic Partnership Forum for creating a space for this incredibly important discussion to take place. So with that, I will turn it back over to Annapurna.
USISPF 4th Annual Summit. And now, here to introduce our next session, a conversation with Minister Smriti Irani, please welcome our President and CEO, Dr. Mukesh Aghi.
Good morning and good evening to you all. Thank you for joining us for this session with Minister Smriti Irani, the Honorable Minister for Women and Child Development in the Government of India. It is my honor to introduce Minister Irani, who is India's youngest Union Cabinet Minister in the government and the first woman to hold office as Union Minister for HRD and as Union Minister for Textiles. A passionate advocate for women empowerment, we are delighted that you could be with us today as we launch the US-India Alliances for Women Economic Empowerment, alongside our partner at US Department of State, USAID, and George Washington University. Since taking over as Minister of Women and Child Development, Minister Irani has worked tirelessly on issues related to protection of children from sexual offenses and the recently announced expanded child nutrition program. She has also been at the forefront of the Prime Minister's effort on gender budgeting and has focused on economic empowerment of women through digital literacy. I am also delighted to introduce USISPF board member and former US Ambassador to India, Rich Verma. Ambassador Verma now serves as the General Counsel and Head of Global Public Policy for Mastercard. A veteran of the US Air Force and a lawyer, as Ambassador to India, he championed historic progress between US and India in defense, trade, and clean energy. We look forward to your conversation today with Minister Irani on development and women's economic advancement in India. With that, let me turn over to Ambassador Verma. And welcome, Minister Irani.
Mukesh, thank you. Minister, thank you for being here. Thank you for your service. Thank you for your commitment to the US-India partnership. The Prime Minister just had a terrific visit here to the United States, and I want to talk to you about one of the initiatives that Mukesh talked about, the alliance. But I want to jump right into it because we don't have a lot of time. You recently mentioned that the government endeavor of building a new India should be on the basis of women-led development. Tell us what you mean by that and what some of your priorities are as you go forward towards that goal.
Good evening, Ambassador, and my greetings to Mukesh and everybody in his team. I think I take a leaf out of the Prime Minister's agenda, who spoke of the fact that for years in our country, we've spoken about empowering women, but it's time to recognize that if we have to build a resilient nation, we need to ensure that women lead development, and it is a women-led development agenda throughout all ministries and departments of Government of India, which means the Prime Minister, who has persistently focused on convergence of efforts and ideas, who has not only spoken of but also engaged in cooperative federalism, now seeks partnerships within government, with states, and with citizens across the country, so that women become the fulcrum not only of the development agenda but also the societal agenda. Many of Prime Minister's flagship scheme, in fact, are indicative of his desire or of his agenda. To begin with, in the year 2014, the Prime Minister was insistent that every Indian citizen who has till then been unbanked, is not availing any financial services from our banking institution, is given the privilege of opening a bank account with the support of the Government of India. I'm happy to share, and Ambassador Verma, you are aware of the staggering numbers that came to the fore. Under Jan Dhan Yojana, we had 440 million Indians who, for the first time in their lives, had a savings bank account, of which, as a female, I'm extremely proud that 220 million beneficiaries were women. The Prime Minister believes that if we want to engage with our citizens with regards to subsidy, grants, or financial support, we need to ensure that transactions with the Indian Treasury are transparent. And one of the basics that women had met during the pandemic, especially, is when the Prime Minister insisted that the Treasury transfer money directly to the bank accounts of women during lockdown, thereby ensuring that their purchasing power is sustained. We also saw the remarkable success of the Mudra Yojana, which is a collateral-free loan given by banking institutions with support of the Government of India. Though this program was not gender-inclined or gender-focused, we were happy to celebrate that of all the beneficiaries, 170 million Indian women kickstarted their small enterprises with the support of this flagship program. You're also aware that we have had, for the first time in the history of our country, a mammoth health support mechanism under Ayushman Bharat, wherein 100 million families for the first time receive medical cover, close to 5 lakh rupees across 24,000 hospitals in our country. And I'm happy to today state, Ambassador Verma, that of the benefits that have accrued to these 100 million families, we have seen over 10 million Indian women in just one financial year get support and get medical facilities to get themselves tested for breast cancer and cervical cancer. And these are cancers that women, especially in the rural belt, were not known to have knowledge of or approach medical establishment to get aid for themselves. There have been many ambitious programs of the Prime Minister. Again, Ujjwala Yojana, clean cooking fuel for 80 million women. It's again a staggering number which highlights that irrespective of which department the government of India functions from, women become the center of the agenda, women become the center of expenditure of government of India, and women become the center of, like I said, building back better.
Yeah. Thank you for laying out such an incredible array of progress and your priorities in financial inclusion, small enterprise, health, energy, and so much more. Maybe you could say a little bit about what the obstacles are that you're facing. And, you know, the great thing about this organization, US India Strategic Partnership Forum, is that you've got America's largest companies and organizations who are committed to India. How can we help you as you deal with those obstacles that you have in front of you, the remaining obstacles?
I think, especially during the pandemic, we had 6 million plus female workforce as doctors, as medical health professionals who led the charge in facing or fighting the pandemic. We have seen a consistent effort by the government to ensure that basic needs of women, be it building of toilets, wherein the Prime Minister's flagship program, again, the Swachh Bharat Yojana, ensured that 100 million women now have individual household toilets that they can access. National education policy, which has now found a change after 3 decades. At the center of it finds a gender inclusion fund, the first ever in the history of our nation. We also have a Prime Minister who for the first time institutionalized menstrual hygiene administrative protocol for women in our country. So if there have been challenges, I can only count a few. One, we want to encourage more and more women to transverse from higher education to institutions of national and technological importance. We have seen that our girls outshine our boys in grade 12 with their results. But when it comes to them graduating onto institutes of repute, universities and colleges, the numbers are still challenging. We would want to ensure that our girls gravitate more towards mathematics and the science stream. We are committed as a government to ensure that women in our country do find leadership roles in corporate organizations, do find leadership roles even in administration. We have a finance minister who is a female who's held a portfolio earlier as defense minister. And I think that what we celebrate is that this change is being led by a man, thereby indicating to our nation that if we talk about putting women at the center of the development agenda, it is an agenda that needs to be fulfilled by men and women together.
Yeah, that's a great point. You mentioned both corporates and you mentioned the government. And I know you've spoken about both of those, that you need more women in corporate leadership positions on boards of directors. And you also want to see more women in government and in public service. India also has very impressive numbers in that regard, but still a ways to go. How do we achieve both those goals in the corporate sector and in politics and in public service as well?
The Prime Minister, again, like I said, has led from the front when it comes to organizationally ensure that the Bharatiya Janata Party, the political organization that we all belong to, has created equal space and opportunity for women. Ours is an organization that has ensured that there is adequate space organizationally, not only in the main party body, but also through subsets like the women's wing. We ensure that we support more and more women from the grassroots to come into the political mainstream. I also think that it is essential here to highlight that in India, we have the highest number of female politicians in office in our panchayat, which is our rural government structures, in our urban local bodies, where we see their participation grow such that when we quantify their contribution, we see that wherever women have held political and administrative office, we see that the Sustainable Development Goals or the Human Development Indices measure women and their participation and their performance much better as compared to men, with all due respect to the men on the platform today. So I think that if there is a direction in which we all need to head at, we need to ensure that we can help enhance their capacities to serve. Women have been many a time spoken about from the perspective of needing aid. I think they just need facilitation of more opportunities to learn best practices from across the world. And if we can facilitate them with that new knowledge, there's much that they can achieve on their own.
Can I talk about two specific areas? Again, areas that you've talked about. One is digital literacy, and the other is in kind of skill development in technology specifically. And that's something, you know, at Mastercard, we've been proud to actually focus on digital entrepreneurship for women and small and medium enterprise businesses that they lead. But I wonder if you can talk about the gap there that still needs to be filled on digital literacy and technology specifically.
There isn't an oft-spoken program of the Prime Minister called PM Disha, wherein the Ministry of Telecommunication has ensured that over 20 million Indian women are now digitally made literate under the aegis of the government of India. We have over 300,000 common service centers that operate across our country, especially in the villages, and of them, 60% are manned, may I say that, by women. But I think that, yes, there have been opportunities that have been digitally amiss for women, not only in India, but across the world. We have to make a distinction when we look at technology as to whether we want to reduce women to just consumers of that technology, or do we want them to be technological leaders? And if we want them to be technological leaders, we need to ensure that, yet again, like I said, our insistence has to be that women incline more towards mathematics, towards science. There has been enough research done which shows that women who are innovators may not find that much space in terms of support with regards to investments in their startups, especially if they're technologically inclined. So if we can get the private sector to focus on female innovators, if we can get the private sector to focus on helping women who are innovators but who do not control their own IP, I think there's much of a contribution that I foresee on behalf of this alliance. This has to be said that this is not a challenge that women only in the subcontinent face. World over, wherever positions in technology then ensue money or ensue power, you see women getting replaced by men. So I think that balance has to be brought forth, but we are all at least committed towards bringing that balance. The initial, I think, stage of bringing that balance is to recognizing that the challenge exists or the bias exists.
Are you particularly focused on rural areas over urban areas or particular regions of the country? I'm just trying to think about focus as U.S. organizations and U.S. government and U.S. companies come in to assist, trying to understand your priority areas, even geographically or sectorally.
In a constitutional position, Richard, you cannot say that I will serve only one subset and not the other. That would be an extremely irresponsible position to take. But I must say here that the Prime Minister has specifically identified over 100 aspirational districts in our country where education, health, and other services have been a consistent challenge over a number of years. The agenda behind identifying those districts was to ensure that there is a very aggravated intervention by officers and departments in the government of India and in state governments, so that together we can partner in bettering national and international benchmarks and averages. So I think that while the whole of government is particularly inclined towards ensuring that our SDG goals and our SGI numbers are bettered in those aspirational districts. Today in the government of India, irrespective of which ministry you serve in, for us, the whole of India is of importance. Challenges, be it rural or urban, need equal attention, need equal focus, and need expeditious solutions.
We didn't get a chance to talk about children, which is also a focus of your ministry, and you spend a lot of time on children. I wonder if you can just say a little bit about, again, your priorities in that area, how the pandemic has impacted education for children, health for children, and again, what we can do to help you and the ministry.
We've had our partners in the Ministry of Education lead from the front with regards to ensuring, and had the privilege of being the Minister of Education in the year 2014 and 15, wherein we had, and I think that's a hallmark of the Prime Minister's leadership, that you recognize opportunities that can serve you better when challenging times come upon you. And in the year 2014-15, we had the opportunity of digitizing our entire curriculum and making it available free of cost to our citizens. We started a program called Swayam, wherein over 1,000 courses across all faculties of higher education was digitized, made available. Today, we have over 10 million students from the higher education segment who are studying on those platforms. We have had a pronouncement by the Government of India, a production-linked incentive, which looks at making more and more affordable mobile devices in India, so that while at one end we have curriculum and other educative principles and initiatives made available to citizens free of cost, on the other hand, we can facilitate affordable devices for those who are not financially empowered enough to, let's say, buy an iPhone. So while the pandemic broke out, the government was cognizant of the fact that we've had children who have special needs, and special need teachers were allocated to each child. We had a great partnership not only with state governments but also district officials, and we went down to the grassroots to ensure that not one child with regards to education was left behind. We have a force of 2.6 million women working out of Anganwadis, wherein we had doorstep delivery of supplementary nutrition to the doorstep of close to, we have 9 crore beneficiaries on our digital systems right now. We track each and every delivery of nutritional meal to each and every family. That being said, this is in addition to the Prime Minister's pronouncement of ensuring that 800 million Indians receive free food and ration for 14 months, the largest ever such initiative in the world. So I think it should suffice to say, irrespective of which department or silo, as you call it, administratively you serve in, it has been my consistent privilege that the Prime Minister has ensured that every department is dedicated to the cause of women and particularly children.
Yeah, that's great. And Minister, I think I have time for one more question, and I wanted to focus in on the Prime Minister's visit, which was a terrific visit, as I said, with a lot of deliverables. And one of those deliverables was a new announcement focused on women, and it's, in fact, the U.S.-India Strategic Partnership Forum partnering with the State Department, USAID, and we're delighted to have Ambassador Power come on in a few moments to talk about this, George Washington University, to bring together an alliance for women's economic empowerment, and focused in on a few areas like women's entrepreneurship, leadership in the workforce, and providing access to career-enhancing education and skill-building opportunities. So we're excited about it. We look forward to working with you about it, and just maybe any words that you would have for our members as we embark upon this initiative with you.
I think, Richard, the fact that Mudra Yojana threw up 170 million enterprising women who have the capacity to run small businesses, that tells you that the future is wide open as far as India is concerned. We are proud, not only are our girls leading the medal tally at Olympics, but also our space missions are headed by women. So for us, it is a great opportunity to partner, because together when we partner not only so that India can be resurgent, but the world together can be resilient.
Well, thank you, Minister. Really appreciate you being with us here today. We look forward to working with you on that initiative and so much more. Your door has always been open and accessible to all of us, and we're grateful for that. And with that, Mukesh, I'll turn it back over to you.
Thank you.
Well, thank you.
Thank you very much.
Smriti, thank you very much. And we look forward to working with you. And on my next visit to India, I'll definitely come and knock at your door and take this discussion forward.
Look forward to it. Thank you, Mukesh.
Thank you.
Ladies and gentlemen, thank you for joining us for the USISPF 4th Annual Summit. Once again, here to introduce our next session, a conversation with Ambassador Samantha Power, please welcome USISPF President and CEO and Co-Chair of the U.S.-India Alliance for Women's Economic Empowerment, Dr. Mukesh Aghi.
Good morning and good evening to you all. It's a pleasure to have you all with us today for the launch of U.S.-India Alliances for Women Economic Empowerment. Today, we are extremely honored to host Ambassador Samantha Power, the administrator for USAID, to help us launch this important initiative in participation and conversation with our board member, Ambassador Rich Verma. As we celebrate India at 75, USISPF has taken a close look at what more we can do to truly achieve inclusive prosperity in India. We know that a vital place and part of achieving greater inclusivity means that we must bring the private and public sector together to advance gender equality and equity in India. Women represent nearly half of the population in India, so it only makes sense that greater inclusion of women in India's economy will be critical to advancing India's economic growth. In fact, the IMF projects that increasing gender parity in the economy would bolster India's GDP by double digits. Unless we make conversation about women workforce participation central to discussion about trade and growth, we will not be maximizing India's economic potentials. That's why, working with USAID, USISPF launched our South Asian Women in Energy effort earlier this year. And we have already seen fantastic engagement in this initiative by our member companies. Today, we are building on the momentum as we seek to support gender equity and women leadership across all the sector in which we work. Together, we joined forces with the U.S. Department of State, U.S. Agency for International Development, and George Washington University to establish U.S.-India Alliances for Women Economic Empowerment. You will hear more about this exciting public-private partnership from our next eminent speaker, USAID Administrator Samantha Power and Ambassador Verma. I am thrilled to co-chair the alliances with the State Department Assistant Secretary for South and Central Asian Affairs, Don Liu, Senior Official for the Office of Global Women Issues, Kat Fotovat, and USAID Assistant Administrator for Asia, Karen Freeman, working with the Executive Committee comprised of senior leaders from George Washington University, USISPF, USAID, and the State Department, and cooperating members. Together, we will make meaningful contribution to advancing women's economic resilience and advancement, and I look forward to working with our members to make great strides. Without further ado, let me introduce our speaker, Ambassador Samantha Power, USAID Administrator, and Ambassador Rich Verma, General Counsel and Head of Global Public Policy for Mastercard and former US Ambassador to India from 2014 to 2017. Welcome, and over to you, Ambassadors.
Thank you, Mukesh. Thank you, Mukesh. Ambassador Power, it's wonderful to see you. And thank you for joining us. It's really great. And I know you have a significant announcement to make here, building on what Mukesh said as well. But I also just want to say to everyone what a privilege and honor it was to work with the USAID team in India when I was ambassador. It's a storied mission. It's an amazing group of people. And you had the pleasure when you were a UN ambassador to come out there in 2015. And I wonder if you can just I know we'll get to the announcement in a second, but just say a little bit about why you came to India, and you made it such a priority, and you had a terrific visit.
Well, you're only succeeding in reminding me that I'm overdue to get there again now as the actual USAID administrator, because we do have such an incredibly historic and important partnership. It's so gratifying I'm imagining just how much even more gratifying it'll be as USAID administrator, because just the number of individuals who I think have been touched by this partnership, whether it's on fighting gender-based violence or sexual trafficking or starting small businesses and supporting women entrepreneurs, which we'll talk about today, or in the climate space, there is so much going on in terms of transition to clean energy and renewables, but also now increasingly we're having to look at adaptation programs because of the number of people who are just affected by the changing climate that is already upon us. So all of that was at work back in the day when you were there, Rich, but I'd be lying if I said that one of the factors for coming was not to see you, because to watch our first Indian American ambassador on his virtual home turf, that was quite a thrill as well. It sent an amazing signal, I think, and it's such a representation really of the number of Indian Americans, how they've enriched our country, how so many of you have become such trailblazers here in this country, and so that was a big part of it as well.
Oh, that's nice of you. It's nice of you to say that. I should tell people that we had the opportunity to work together, I think, starting almost 15 years ago when you were working for a senator from Illinois at the time, and then we got to continue our work together through the administration. And your team, your current team, the USAID team in India, took me around the country. They showed me all the projects they were working on, and we got particularly focused on a health project, ending tuberculosis once and for all in India. And it was, again, an amazing experience. So first of all, thank you for your service. Thank you for stepping up to the plate again to lead this great agency. Tell us about the announcement and the initiative that we want to talk about today.
I will, and thanks to all of you for giving us such a great forum to bring this home. So the Biden-Harris administration is pursuing a comprehensive plan to promote women's economic empowerment, help end gender-based violence, and tackle other inequalities. And so what I'm here to announce today is the launch of the U.S.-India Alliance for Women's Economic Empowerment, along with the U.S.-India Strategic Partnership Forum and George Washington University. So we are in this together. This is a new public-private partnership. It'll bring together U.S. and Indian businesses, philanthropies, academic institutions, and civil society. The goal is to support, again, women entrepreneurs, job access, career building, mentorship, and so forth. You know the statistics, Rich. You were one of the great champions of this agenda when you were ambassador and before that. But McKinsey has found that closing the gender gap in the workforce would add $13 trillion to the global GDP by 2030. And of course, given how important India is to the global GDP, tackling this agenda in India is really important. In the agricultural workforce, the FAO found that if women farmers had the same access to resources as male farmers, the number of hungry people in the world could be reduced by 100 to 150 million. So this alliance has been in the works for some time, well before my time coming on board and joining the Biden administration. And so launching the alliance is the first step, but happy to talk more about USAID's role in the alliance and how we see the private sector, which really is, I think, the linchpin, because this is such, we know how systemic so many of these issues are. There are so many different structural dimensions of it. So, we know that stating this broad ambition is necessary, but not at all sufficient. So eager to talk with you and eager to enlist people in the audience as well to be part of this.
No, it's great. It's an incredible initiative, and again, thank you for leading it at USAID. You know, it is the case study for a public-private partnership, and we talk a lot about public-private partnerships and not often knowing what they're going to deliver or what they're working on. But USAID has the technical expertise, you have the science, you have the data, and the corporates and the partners at GW and USISPF can all come together. Just tell us how we can best serve this initiative. You're talking to kind of America's biggest companies right now and the representatives here. So what can we do to really actually make this work?
Well, let me give you, if I could, Rich, just a couple examples, because you're right. I think the public-private partnership umbrella, you know, it can describe a lot of different things. And I actually think the folks in the audience will know best, you know, what they bring and their comparative advantages. So rather than speculating there, let me offer examples of the first couple initiatives that we're going to be moving out on. So one is called Women at Work, and it's led by an alliance member, Samhita. And this basically seeks to bring together coalitions of business, philanthropic organizations, like I said before, but very specifically to address the needs of marginalized women who've been affected by the pandemic. So again, we could have a pre-COVID initiative, and our partners on the ground have been doing this kind of work with marginalized women, you know, for decades. But this is very specifically looking at the knock-on effects that the pandemic has had. And the idea is through funding and through mentorship that we will try to give these women, again, who will be identified by our partner, you know, Samhita, which knows best kind of how to go about doing this, but identify women and then help foster those women's access to tools to do everything from build their own digital business, invest in and develop the care economy and the support economy, which is incredibly important. And then assist where a lot of these women gravitate toward informal women-owned businesses and working to help those informal businesses register and join. So I think that's sort of concretizes it a little bit. Then a second initiative that we are pursuing as part of this alliance is called the India Million Women Mentors Initiative. And this is led by a different alliance member known as POD, which you may know and I think maybe hear today. And this is a corporate partner that specializes in social media mentorship platforms. And the goal here is to connect 1 million women and girls in small to medium-sized cities in India with mentors in the United States and India. And so here again, to give young women and girls career advice about schooling and education, to plug them into our networks, and, you know, as the needs arise, potentially also to do some skill building as well. And the goal over time is to give these young women the ability to launch and potentially scale companies, or to build more meaningful careers, and to, you know, to encourage them from a very young age to pursue leadership roles and to kind of aim big. So I think that's very creative. And again, we can provide contact details for people involved in this, for those who think that they'd like to plug in and be mentors for that initiative, or to be involved in the other one.
Yeah, both initiatives are really terrific. And I think you'll have a lot of interest and people will be looking to get engaged. And could you spend just a little bit more time talking about the impact of COVID-19? And your first initiative really addresses that. But women in particular, women entrepreneurs, women small businesses have been kind of unduly hit by the pandemic in a way. And maybe just what you're seeing as you travel, what you're seeing and what the Alliance can do in India to help alleviate some of the damage that's been done.
Yeah, I mean, there's a lot one can say about COVID. You know, people have referred to it as the great revealer. So to some extent, you know, whatever those inequities were, you know, prior to early 2020 when the pandemic struck, just as in this country, you see those inequities exacerbated. I think even in our own domestic context here, Vice President Harris has called the number of women who've dropped out of the U.S. labor force a national emergency. And as we know, even though, job returns are increasing here, there's a lag when it comes to women and who are often the care providers at home. And so women in India, I think, are no exception to this great revealer and great exacerbator phenomenon. The studies have shown, greater difficulty accessing financial services, in these lean economic times, and inability to take out loans. If you're a female-owned restaurant and that restaurant has had to close because of COVID and inability to cover that or get banks to treat you equitably, as your male counterparts. Then again, something we all identify with, but the unpaid care and domestic work that women have been doing, and with kids again at home in many parts of India. And just the knock-on effects of business closures and women, even if it's not formally women-headed household, women bearing the lion's share, figuring out how to feed the family and so forth. So again, it's in knowing that there have been these disparate impacts everywhere, and including in India, and where you had such such issues of marginalization and economic vulnerability that even predated this, and had women making great strides, it has to be said. I mean, tremendous strides in so many sectors in India and showing tremendous leadership. But, this has just been a real blow to some of the progress that had been made. And so part of what we're trying to do, as you've indicated, the first initiative I mentioned really speaks to this, is, both address the hole that some women find themselves now, and I identify women who could really benefit from some support to bring them back to where they were, but also learn from this experience and see that, in every crisis, these disparate effects are going to be felt, unless and until we've created more durable platforms, that women can access as equally as men. And so we feel like, for all of the horrific disparate impacts that I've discussed and people are so familiar with, COVID has also shined a spotlight on these disparate impacts. And it's, what was it Rahm Emanuel used to say, don't let a crisis go to waste. But with the kind of attention to the inequities, we feel like it's an opening, for philanthropies, businesses, academic institutions to come together and support our non-governmental partners and those, in the public sector that are really trying to address this problem systemically. So it's to recover and build back better, I guess you might say, to coin a phrase.
No, it's great. And that's, I think of our own experience, in the private sector and at Mastercard, for example, we're partnering with the Development Finance Corporation and with HDFC Bank in a new $100 million initiative to help small and medium businesses, but women-owned businesses primarily, and to focus on imparting digital skills and helping their businesses go digital. So that's the kind of thing I think a company like ours can do, but there's so many other examples of what we can get done together. I wanted to maybe just shift your attention a little bit towards India itself as a development partner. And, a lot of activity over the last week. We had the visit of Prime Minister Modi, and then we had the Quad meeting the very next day. How do you think about India as a partner in the development challenges that we face, not only for our collective populations, but around the world? What's possible?
Yeah, I mean, I think that I've talked to Minister Jaishankar about this. I talked to him about it, I guess, back when he was not Foreign Secretary, when I was visiting there with you. But it's striking just in the, what would it be, probably 5 years that have elapsed since my visit, I think, to see you in India, 5 or 6 years. But just even now, the greater possibilities and the greater realities of what our trilateral cooperation in other parts of the world can look like, and what a and COVID, which of course has been, such a searing crisis for the people of India, where USAID has, and all of you have really tried to step up and support India. But what is clear now that the export ban on vaccine manufacturing is going to be lifted is that India is going to play one of the most important roles on planet Earth in bringing this pandemic to an end because of its innovation, because of the investments that have been made over a long period of time in expanding vaccine manufacturing capacity. And so while there's been, right now we're in a really difficult period because there are significant vaccine shortages, as you know, and shortages in vaccine supply, India is very soon going to be back online as the a critical engine in meeting the targets that the world's leaders just rallied behind at the COVID summit, which is namely to get 70% of each of the world's countries' populations vaccinated by the UN General Assembly next year. And as you know, with sub-Saharan Africa and other parts of Asia, some parts of Asia, we're not that close to that. And that gives you some sense, not only what the United States is going to bring online with more Pfizer donations and so forth, but what we know India has to contribute. And I think it's also India as an inspiration. And I'll stay on COVID just because it's certainly the topic of our time, along with climate. But in both domains, in fact, as India innovates in its transition to renewables on the climate front, as it extends its vaccine manufacturing capacity, not only for COVID vaccines, but now to make itself, again, a hub for vaccinations for vaccines for other diseases that have been concentrated in the developed world, that manufacturing capacity, that's giving a lot of countries ideas. We're talking to Rwanda, to Senegal. We've just, through the Development Finance Corporation, made a big investment in South Africa. And, I think once India is in a position, to move past COVID in the way that, of course, it's in the interests of the Indian people to do, and we're seeking to support them to do, for it to bring its expertise to bear on how a country like South Africa can extend already what it is doing in the manufacturing space. We really do want to build back better after this pandemic so that there's much more decentralized manufacturing capacity. So I think COVID's a great example, but it extends so far beyond that. I think there's so much in the agricultural space, so much in the micro enterprise space where India has been a trailblazer. And we, at USAID, we take the lessons we learn from our USAID mission and the programs we're fortunate enough to have visibility into, to see the dynamism of the micro lending world in India, and taking those lessons on the road. We've always done that. We've always learned from our partners in India and tried to inject that learning into what USAID does. But now the exciting thing is we get to do it alongside Indian development experts who are willing to bring that expertise to bear in other parts of the developing world, to see if we can replicate some of the successes and that dynamism elsewhere. So it really feels, and the Quad, which is just one example, I think, of this outward-facing, exciting set of possibilities, for India and the United States to be in lockstep, but trying to help others deal with the toughest problems of our time.
Yeah, it's a really, really great point, and I think it creates a lot of excitement. I've heard President Biden and Prime Minister Modi both say that it's too limiting to think about what the U.S. and India should do for each other. It's really the impact we can have on the greater global good and for people who need the assistance, and that's exactly what you were talking about. Unfortunately, our time has run, and I just want to, again, thank you for your incredible leadership. Thank you for leading this alliance effort, again, of which USISPF is proud to be a member, along with our other partners. And we look forward to working closely with you and your team in the months and years ahead. And we'll certainly be a close partner as we go forward.
Thank you, Rich. Thanks for doing this. Thanks for your leadership. And let me just close by saying that it is a tremendous audience that you've assembled here today. This U.S.-India Women's Economic Empowerment Alliance, I think, creates a space for all of you. So we will make sure that you have information about how to follow up. And once you get more visibility again into the specific initiatives that are part of this alliance, I think you'll be able to find your slice of it. But we really think the success of this, given the scale of the ambition, is going to turn on our partnership with you all. So thank you so much.
Thank you. Appreciate it.
USISPF's 4th Annual Summit. The session recordings will be available on our website and YouTube page. Thank you for joining us, and we'll look forward to seeing you at another one of our events soon. Goodbye.